Hi, I'm Monique DeLuca. I'm a physical therapist and I work for Johns Hopkins Medicine. I'm primarily located at our Columbia Clinic in Howard County. So I am a fellowship trained performing arts physical therapist. So I specialize to work with performing artists of all different types. So dancers, musicians, figure skaters, actors, even some gymnastics as well. I've been involved in various types of performing arts, both dance and music. Under the dance umbrella, I've been involved in various types of genres of dance, including ballet, pointe, tap, jazz, lyrical, modern, contemporary, and even a little bit of acrobatics. I grew up dancing at a local studio and did regional dance competitions. I then went on to minor in dance while obtaining my degree in physical therapy. In addition to dance, I also was involved in music. Growing up in high school, I played electric bass guitar and jazz band, along with flute in marching band and the local high school band. Additionally, I used to sing in high school chorus. The most common injuries that we treat vary by the patient and what kind of area they fit within performing arts. So for dancers, the most common area to be injured is the foot and ankle. However, a lot of times when someone injures their foot and ankle, we'll often treat more proximally, which meaning like the hip and the core. So when you're dancing, you're doing a lot of things on one leg or up on releve, on pointe. So there's a lot of instability, and that's where strengthening the hip and the core is really important to help not just the hip and core, but also to help the foot and ankle. For musicians, it varies. So musicians, they're doing a lot of stuff with their upper extremities, they're playing their instrument, it's a lot of repetitive activity, long practice hours. So the injuries that musicians typically have are usually more the upper extremity or like neck, shoulder region. Hand, wrist is the biggest one. And the biggest thing for them is going to be more postural education and making sure they're aware of what practice training habits are, just because it is very repetitive, to make sure that they're giving their muscles and tissues time to relax in between. However, it's important to note that each patient is unique. So I make sure I listen to my patients to make sure that I can meet their unique needs and make sure that nothing goes unaddressed.